Are you over 65 and taking blood pressure medication every single day, trusting that it is keeping you safe? What if I told you that for millions of seniors, the medication they are faithfully taking is actually making things worse, not better? Today we are covering 7 warning signs that your blood pressure medication may be wrong for your body. Some of these signs are things your doctor may have never told you about. Stay until sign 4 because that one surprises almost everyone. Please note, this video is for educational purposes only. Always consult a doctor before making any changes to your medication. Sign number 1. A persistent dry cough that just will not go away. If you started a blood pressure medication and shortly after developed a dry, tickling cough, this is not a coincidence. A class of medications called ACE inhibitors, drugs like lisinopril, enalapril, and ramipril, cause this in up to 20% of patients. In seniors over 65, that number is even higher. This happens because ACE inhibitors cause a buildup of a chemical called bradykinin in your airways, which triggers that irritating cough. The good news? There is a simple fix. A different class of drugs called ARBs, angiotensin receptor blockers, work just as well for blood pressure, but do not cause this cough. If you have this symptom, tell your doctor. A simple switch can end months of unnecessary suffering. Sign number 2. Swollen feet, ankles, or lower legs. This one is often dismissed as just aging. But if your ankle started swelling after beginning blood pressure medication, your medication may be the cause. A common group of blood pressure drugs called calcium channel blockers, including amlodipine and nifedipine, are well known for causing fluid retention in the lower legs. According to a study published in the Journal of Human Hypertension, ankle swelling from calcium channel blockers affects nearly 1 in 3 patients over age 65. This is not just uncomfortable. Swelling can increase fall risk, affect your mobility, and reduce your quality of life. If this started after your medication, it is not normal. Report it to your... Sign number 3. Feeling dizzy or lightheaded when you stand up. This condition has a medical name, orthostatic hypotension. And it is extremely common and dangerous in seniors on blood pressure medication. Here is what happens. When you stand up, your blood pressure briefly drops. In healthy adults, the body adjusts within seconds. But when medication is lowering your blood pressure too aggressively, that adjustment does not happen fast enough. The result? Dizziness, blurred vision, and in serious cases, fainting and falls. Falls are the number 1 cause of injury-related death in adults over 65. And according to the CDC, medications, especially blood pressure drugs, are a leading contributor. If you feel dizzy when rising from a bed or chair, your medication dose may simply be too strong for your body. This is fixable. Sign number 4. And this one surprises most people. Constant, unexplained exhaustion. Many seniors on blood pressure medication say the same thing. I sleep 8 hours, but I'm still exhausted. I have no energy. I feel like I'm dragging through the day. They assume it is just age, but it may be their medication. A class of drugs called beta blockers, metoprolol, atenolol, carvedilol, are prescribed widely for blood pressure. They work by slowing down your heart rate. And that slower heart rate can mean less energy delivered to your muscles and brain. In people over 65, this effect is amplified. Your metabolism is already slower, so beta blocker fatigue hits harder. This is one of the most underreported side effects in seniors because most patients assume fatigue is just part of getting older. It may not be. Talk to your doctor about this. Sign number 5. Feeling your heart fluttering, racing, or beating irregularly. This one is particularly alarming because most people assume heart palpitations are a reason to take medication, not a sign that the medication is wrong. But certain blood pressure medications, particularly diuretics, water pills like hydrochlorothiazide and furosemide, can cause your body to lose potassium and magnesium through urination. And when potassium levels drop too low, your heart's electrical system becomes unstable, causing palpitations, skip beats, or even dangerous arrhythmias. A 2021 review in Circulation found that electrolyte imbalance from diuretics is a significant and underdiagnosed cause of cardiac events in elderly patients. If you are experiencing any irregular heartbeat, this is not something to monitor and wait. Call your doctor today. Sign number 6. Waking up multiple times per night to use the bathroom. If you're on a diuretic, a water pill, for blood pressure, and you're taking it at any time after noon, it may be disrupting your sleep in a way that compounds over months and years. Disrupted sleep in seniors is not a minor inconvenience. Research published in Nature Aging links chronic sleep fragmentation in people over 65 to increased risk of cognitive decline, depression, and cardiovascular events. The fix here is often simple. Take diuretics in the morning. But many doctors forget to specify timing, and many patients never ask. This is one of those small adjustments that can dramatically improve quality of life, starting the very next day. Sign number 7, and possibly the most important. Your blood pressure is still too high, even on medication. If you have been taking your medication faithfully and your readings are still consistently above 140/90, your medication is not working for you. Full stop. This happens for several reasons. Your body may have developed a tolerance. The dose may be insufficient, or, and this is more common than most people realize, you may have a type of hypertension that responds better to a different class of drug entirely. There are 5 major classes of blood pressure medication. If one is not working, there are others. There are also combination therapies that work better for certain patients. Uncontrolled blood pressure is the single biggest risk factor for stroke in people over 65. Staying on an ineffective medication out of inertia is not a neutral choice. You deserve medication that actually works. So there you have it. 7 signs your blood pressure medication may be wrong for you after 65. Number 1. A persistent dry cough. Number 2. Swollen ankles or legs. Number 3. Dizziness when standing. Number 4. Extreme fatigue. Number 5. Heart palpitations. Number 6. Frequent nighttime urination. And number 7. Blood pressure still not under control. If even one of these applies to you, please bring this list to your next doctor's appointment. You are not stuck with the wrong medication. There are better options, and you deserve to feel well. Always consult your healthcare provider before changing or stopping any medication. If this video helped you, hit subscribe. We publish new senior health research every week. And watch our next video on 5 prescription drugs that steal nutrients from your body after 60. It may be the most important thing you watch this month.